Chapter 24, Emergency Preparedness, Public Health, and the Future Source. Mary-Jane Schneider, Introduction to Public Health, 6th edition. When disaster strikes, who protects the public? From natural disasters to terrorist attacks and pandemics, public health is the front line of emergency response. This chapter explores how emergency preparedness evolved in the US, the systems in place to manage crisis events, and the essential role of public health in keeping communities safe when everything goes wrong. What is emergency preparedness? Emergency preparedness is the coordinated planning, response, and recovery for unexpected events that pose a threat to population health. These include natural disasters like hurricanes, floods, and wildfires, pandemics and outbreaks like COVID-19 or Ebola, bioterrorism or chemical warfare, mass casualty events like 9/11 or active shooter incidents. Preparedness isn't just about having supplies, it's about having systems. 9/11 and the birth of modern public health preparedness. The September 11th attacks and the anthrax mailings that followed in 2001 were a turning point for public health in the US. Suddenly, the nation realized it needed a strong public health infrastructure, better coordination between federal, state, and local agencies, clear communication during emergencies. The result? Creation of the Office of Public Health Emergency Preparedness, now part of the Assistant Secretary for Preparedness and Response in HHS. Bioterrorism response. Bioterrorism is a real threat, and public health is at the center of detection and response. Key strategies include surveillance for unusual patterns, for example, unexpected flu-like symptoms or spikes in ER visits, laboratory response networks to identify pathogens, distribution plans for antibiotics, vaccines, and protective equipment, training first responders and hospitals. Preparedness planning also involves maintaining the Strategic National Stockpile, which stores vaccines, medical supplies, and medications ready to deploy in a crisis. Natural disasters and emergency infrastructure. Public health isn't just about bioterrorism. It plays a critical role in responding to hurricanes, earthquakes, tornadoes, fires, heat waves, floods. In these events, public health supports clean water access, shelter sanitation, vector control, for example, mosquitoes, mental health support, coordination with FEMA and local emergency management teams. Lessons from Hurricane Katrina revealed the need for stronger planning and communication at every level. Communication is everything. During a crisis, what you say and how you say it can save or cost lives. Effective emergency communication requires clear and accurate messaging, trust in public officials, speed and consistency across platforms. The COVID-19 pandemic showed how misinformation can derail public trust, confuse communities, and prolong a crisis. Risk communication is now a public health core competency. The COVID-19 wake-up call. COVID-19 exposed both the strengths and weaknesses of global preparedness. Public health led efforts in contact tracing, testing and vaccination, risk communication, hospital surge coordination, but it also revealed supply chain fragility, underfunded local health departments, political interference in public health decision making. The lesson: we must invest in public health before the next emergency hits. Planning and practice. Preparedness isn't just a document, it's a process. Agencies must create all hazards plans, conduct drills and simulations, coordinate across sectors, police, fire, hospitals, public health, and government. After action reports from past emergencies help improve readiness for the future. Preparedness is not one size fits all, it must be local, flexible, and community based. Conclusion: public health emergencies are no longer if, but when. Whether it's a new virus, a hurricane, or an act of violence, preparedness saves lives. But readiness requires strong systems, trusted leadership, investment in infrastructure, and the ability to communicate clearly in moments of fear. Public health is your safety net in crisis, and the time to build it is now. Call to action. This video is based on Chapter 24 of Introduction to Public Health by Mary-Jane Schneider, 6th edition. If this helped you understand the role of public health in emergencies, share it and comment. What kind of emergency preparedness does your community need most?